Knock, knock, knock.
Come in.
Hi, Miss Lynn. How are you today?
Hi, I'm doing good.
I'm Miss Abby. I'm a PA student that's going to be taking care of you today. So, what brings you in?
I have a really bad headache.
Where's it? When did this start?
Actually, I've been having it about probably 3 days. And today I've had it all day long.
All day long?
All day long today. I have taken a Motrin.
Whoa. Where is it at on your head?
Mostly like
in the back?
Back, around this, right here.
Cool. So you said it's been lasting all day today, but it started 3 days ago.
Yes.
Those 3 days, has it been constant or has it stopped, started?
Kind of off and on.
Off and on?
Today it's been solid headache.
Okay, cool. So how would you describe the pain?
On a scale of 1 to 10, I'd say like a 6 or a 7.
With 1 being the best, 10 being the worst?
Yes.
It's like a 7?
Yes.
But how would you describe the pain itself? Like, is it an aching? Is it a sharp pain?
Kind of like just irritating.
Okay.
Bright lights kind of bother me, so I feel like I can't look at the lights.
That's unfortunate. Do you have anything that makes it feel better or worse?
Well, I took a Motrin.
Okay. How did that work?
It really didn't help, so about 2 hours later, I took a second Motrin, and that seemed to kind of help a little bit.
Okay, so it made your pain go down.
Yes.
That's good to hear. So you said that some associated symptoms with it is that it hurts to look at bright lights. Is there anything else that you've noticed from the headache?
No.
Okay, good. Is there anything that makes it worse?
Mm-mm.
That's good. Does the pain radiate anywhere, or is it just in that one spot in the back of your head?
Kind of just in that one spot. Comes around to the back.
Okay, good to hear.
You did ask me about other symptoms. I do kind of get, I do have a little vertigo sometimes with my headaches.
Okay, so you have a history of vertigo?
I do have a history of vertigo.
Okay, well, I'm going to get back to that.
Okay.
Have you had any previous episodes of these headaches? I guess that would go into the vertigo.
I have had headaches before associated with the vertigo.
So you think it's associated with that? It's
possibly,
similar to those episodes?
Possibly.
Okay. All right, well, that might be a reason of why you're having these. So I'm just going to go over some general symptoms if you've had any. Have you had a fever?
No.
Any chills?
No.
Have you felt any overall feeling of weakness?
No.
Any general weakness?
No.
Have you noticed any appetite changes?
No, but I have been a little nauseous.
Okay. And that's when you have the headaches or just overall? Yes. Have you had any weight change?
No.
And any fatigue?
No.
Have you noticed that the pain is better or worse at the night or the morning? Does it wake you up at all?
Not necessarily. During the day, it seems like it bothers me more because I go to sleep and I'm fine.
Okay. So you sleep through the night. That's
yes.
Good. All right. So you said you have a headache. Have you noticed any trouble swallowing?
No.
Any muscle weakness?
No.
Any dizziness?
Yes, I do have a little, I call it off balanceness.
Okay.
So a little couple of here and there dizzy spells.
And do you think that's associated with the vertigo?
I don't know. It could be because I do have a history of having vertigo.
Okay. Have you noticed any problems with your walking?
No.
Okay. Any head trauma?
No.
Have you ever had a head injury or anything? Have you noticed any memory loss?
No.
Any numbness?
No.
Any burning or tingling feeling?
No.
That's good. Have you had any seizures?
No.
Any episodes of passing out or losing consciousness?
No.
All right. Have you noticed any altered mental status?
No.
Any confusion or anything?
Mm-mm.
That's good to hear. All right, so now I'm going to ask about your past medical history. So starting off, I know you said you had a history of vertigo. Is there anything else?
No, just the vertigo that I suffer with.
When did you first get that?
About 2 years ago.
And how have you been treating that?
I sometimes, they had prescribed a medication earlier that I don't take anymore, but I currently take Zoloft.
And that's for the vertigo?
No, but it's actually to help ease the anxiety associated with the vertigo.
Okay. Do you have a history of hypertension, high
No.
blood pressure?
No.
Any diabetes?
No.
Any high cholesterol?
No.
Do you know of any heart diseases that you may have had?
No, not that I am aware of, no.
Well, that's good. Have you had any heart attacks?
Thank goodness, no.
Have you had any strokes?
No.
Have you had any cancer?
I have not.
All right. So, have you ever been hospitalized for anything?
I've had past surgeries, giving birth to 2 children.
Okay.
I have...
How did those go?
I had 2 cesarean sections for both.
Okay.
And I was hospitalized when years ago I had gallbladder removed, so gallbladder surgery.
Do you know how many years ago that was?
25.
You were 25 or was 25 years ago?
It's 25 years ago.
All right. Just yesterday, huh?
Yes.
Are you up to date on all your immunizations?
I sure am.
Have you had your flu shot this year?
I have not because I could not take the flu shot this year because I was allergic to one of the medicines in it.
Oh, interesting. Do you know what you were allergic to?
I am allergic to a medication called genamicin, Genamicin. Sorry.
Are you allergic to anything else?
No, just my husband.
So no environmental allergies, food allergies, nothing like that?
No.
That's good to hear. Okay, so now I'm going to ask about your family history. First, I'm going to ask about your mom. Do you know if she had any?
Yes, my mother passed away in 2010.
How old was she?
She was 64. She passed away from gallbladder cancer.
I'm sorry to hear that.
And then my dad, who passed away in 2011, he passed from...
How old was he?
Leukemia. He was 66. So some family history of cancers.
Do you know if either of them had a history of hypertension?
Dad had plenty health issues. Yes, he had hypertension. My dad did. But not
What
my
about
mom.
diabetes?
No.
Any cardiac problems with either of them?
No.
Heart attacks?
No.
Strokes?
No.
I know you said leukemia for your dad and gallbladder cancer for your mom. Do you have any brothers or sisters?
I do. I have 2 brothers. I have a brother that's 1 year older than me, fairly healthy.
How old is he?
He is 53, and I have a brother that is 49.
And do either of them have any health conditions?
No.
No hypertension, no high cholesterol, heart problems, heart attacks, strokes, cancers?
Not that I know of.
Well, that is very good to hear. Have you had you said you had 2 children?
Yes.
How are they? Boy, girl?
I have a daughter that is 25, and she suffers with Raynaud syndrome, Reuinaud. Her hands and her feet often get cold, and they turn white.
Interesting.
And then I have a son that is 19, and he has some allergies. We're not sure what, but he has some.
That's scary.
Yes, it is scary.
And both of them, your pregnancies went all right? They went to full term and everything?
Yes.
Okay. Did you have any other pregnancies?
I did have a miscarriage between my first child and my second child.
How long did you get?
Not far at all. It was, I found out I was pregnant, and it was probably not even 3 or 4 weeks.
Okay. I'm sorry about that. Okay, so now I'm going to ask a little bit about your social life. Do you smoke any tobacco?
No.
Do you vape? Do chewing tobacco? Anything
No.
like that? No cigars? No. Awesome. That is good to hear. Any alcohol?
I do. Occasional glass of wine here and there.
Okay. What is occasional? Like every
Um,
few days?
every couple of days.
Okay, and how much do you drink when you drink?
Maybe 1 or 2 glasses.
All right. Do you do any illicit drugs?
No.
How is your diet?
Pretty good. Been trying to follow keto diet.
How's that been going?
No, pretty good. We've lost, my husband and I lost some weight.
Okay.
And we're trying to get back on it again with this coronavirus. Kind of being home has made us a little off the diet, but trying to get back on it.
Well, that's awesome. What about exercise?
I've been walking a lot. So go walking. I walk about 2 miles a day.
That's really good.
Track my steps. I try to get about 10,000 steps every day.
Okay, cool. Do you have a job?
I do. I'm a teacher.
That's fun. What grade?
I work with 3rd and 4th grade students. I work with the struggling readers. So I guess I'm like an interventionist.
Do you consider yourself to have any health insurance and you're good with all of that?
Yes.
Do you have any problems affording medication?
No.
Getting to the doctor's office?
No.
Okay,
No.
good.
Everything seems to be good at home.
How would you describe your living situation at home? Are you married? Do you kids?
Married.
Awesome.
Married, 2 children. They all live in the household with us, my 2 children. Even my adult daughter, she lives in the house with us. So yeah.
How would you
everything's
describe your stress level?
Probably mediocre to maybe sometimes high.
What causes this stress?
I don't know. Coronavirus?
I feel you there.
Yes.
And what is your sexual history? Are you sexually active?
Yes.
Do you use protection?
I do not because I am, I guess, post-menopausal. So I don't need it.
All right. It looks like I have everything here. Do you have anything you need to tell me or anything we might have missed that you wanted to talk about?
No, I don't think so.
All right. Well, thank you so much for coming in. It was great talking to you today, and hopefully we can figure out what's wrong.
Thank you.